Hi, my name's Lauren Thomas. I'm a registered nurse in British Columbia with the Fraser Health Authority. I work on the regional advanced care planning team as a nurse clinician. When it comes to substitute decision makers, really, I don't have the answer for that, but the public does. And often when I'm speaking to the public about advanced care planning, we ask them themselves, who would be a great decision maker? What are the kind of qualities that you would look for in somebody who's about to make a medical decision on your behalf? And a lot of them respond with the same adjectives or the same responses. It's always, someone who knows me really, really well. Somebody who's going to be an advocate and stand up for, my values and my beliefs, while not sort of bamboozling the healthcare team. We want that person to be someone who's good in a crisis, because let's face it, not all of us are, and that's okay. This is not a love competition, about the person in your family or your friends who, you love the most, or, choosing the adult child that's going to be the person who sort of steps into that role, but it's about who's fit to do the job. And I wouldn't pick anybody who's not great with money to be my power of attorney. And so the same goes for a substitute decision maker. You want to find that person that really knows you best. One of the biggest myths in advanced care planning, and that I hope the article is very clear about, is that advanced care planning is often mistakenly seen as something that is related to the death and dying process or to palliative care. A lot of people see it or assume that it's about planning for death and dying, which is an important part of our journey as an adult. But advanced care planning is actually a lot bigger than that, and it actually starts with healthy adults. And I would argue that even maybe it's a process that something our mature minors can engage in. It's not about planning for death and dying. It's ensuring that those that are around us understand who we are as a person, what's important to us, what brings our life meaning, purpose, and joy. Because it's those values that will be used to make a healthcare decision in a crisis. So if a 19-year-old is skiing down Whistler Blackcomb Hill and breaks their leg and passes out, they're going to need someone to step in and make decisions for them. That kid is going to live just fine. It's not a death or dying situation. It's a broken leg, but still decisions may have to be made on their behalf. Healthcare education really needs to make a change right off the bat at that post-secondary level. So schools of nursing, our bachelor programs and all the nursing subspecialty programs, psychiatric nursing, licensed practical nurses, various programs like that. We need to embed it right in the nursing philosophy when we're teaching people, their profession right off the bat. It needs to be a habit. It needs to be common knowledge. And there's a lot of pieces surrounding advanced care planning, especially when it comes to legislation in our provinces with regards to consent and substitute decision makers, that needs to be very, very clear. When I was in nursing school, we had one day to learn 35 pieces of legislation in British Columbia. That did not prepare me to go into a hospital, into an urgent situation, and help guide patients and families in making healthcare decisions. It's also really important that we include our colleagues, any allied health professionals, social work, dietitians, OT, PT, RT. Everybody has a role to play in advanced care planning, and education should really begin in their post-secondary training as well. And as a nod to our doctor friends, of course, medical school really needs to start focusing on proper communication techniques and helping doctors, again, understand legislation and understand how shared decision-making works when you're in a situation with a patient where you may be presenting a medically indicated treatment. Nurses often ask me, how do I begin this process and how do I support patients and clients through the advanced care planning process? And one of the easiest ways to do that is to actually create your own advanced care plan for yourself first. So it's a do-it-yourself first policy. We know that when people engage in these processes for themselves, it's much easier to guide another person and to coach them through that. So go home tonight from work and have important conversations with your family. Think about what brings your life meaning, purpose, and joy. Think about your values and make sure that your family understands that. Think about who in your world would be your substitute decision maker if you couldn't speak for yourself. Continue these conversations throughout your lifetime as our lives change. And most importantly, make a record of it, and make a record of it in whatever form that you choose. And so really creating an advanced care plan for yourself first is a really great place to start. Secondly, when it comes to patients and clients and supporting them, just start asking questions. I think sometimes as healthcare providers, we make these processes more complicated than they need to be. And when we think about a person's journey through our healthcare system, they're going to have multiple touch points along the way. And so as an individual, what you can do is start asking patients questions. Do you have an advanced care plan? Have you heard of advanced care planning? Can you tell me something about yourself that is really, really important to you? Have you thought about having a substitute decision maker? And so if we can ask patients one question every time we meet them, we can really build a story for those people as they move through their healthcare journey. Thirdly, the last important thing that I would recommend to nurses across the country is document, document, document. Even if I had a patient tell me one day that the most important thing in her life was her dog. And I know that seems like casual conversation, but it's actually not. A patient was sharing with me her values, her personal values, and I documented that in a place that could be seen by the entire healthcare team. Because if there was a healthcare decision that had to be made that affect where she had to live, she was going to be thinking about her dog. And so we need to document these small snippets of information so that they get shared across the continuum. I'm going to go out on a limb here and say that most of us nurses across Canada are really working with fragmented electronic medical record systems. Our notes do not move freely within health conglomerates or outside to community care in different areas like that. And so we need to make sure that our documentation is clear and acceptable. So I think what COVID-19 has done for advanced care planning is really sort of, it's been a spotlight. It's really shined the light on advanced care planning and really thrown out to the public the need for planning ahead. What COVID has shown us is that COVID knows no boundaries. COVID has taken young people from us, has taken the elderly from us, and has made people sick in various different ways and return to life in very different ways. And so if COVID has taught me anything, it's about having conversations now while you're younger or healthier and making sure that you're ready for a crisis.